And I'm going to repeat that. Good morning, or good afternoon, I guess. This is Tina Pettengill from the Maine Public Health Association. Thanks for joining for our first webinar in the series titled Childhood Exposure to Marketing in Schools, Changing the Scene. We're really excited to bring you this webinar today. We have two fabulous presenters who are going to walk us through a really exciting project in Cumberland County that impacts the entire state and gives us a lot of data and information in which to work from. Just a couple of logistical items before we get started. The first of which is, you guys, if you haven't noticed already, you're muted. So anyone on the line listening is going to be muted throughout the entire webinar. You can, though, that doesn't preclude you from answering or asking any questions. Just go into your chat box and you can type a question out to just the presenters, to the facilitators. You can even chat to other people on the webinar. But we'll be monitoring the chat box throughout the webinar to ensure that we answer all of those questions. We will, however, not answer the questions until the very end of the speaking portion. So after our speakers have gone through their slides and presented the information, we will then read out any questions that have been entered into the chat box. So you can ask your questions throughout, but we will hold them and answer them at the very end. The other thing we'll do at the end is we will unmute participants that want to ask a question. So there's a place for you to raise your hand, and you can do that, and we will also unmute you, and you can ask a question that way. So hopefully we'll give everyone ample opportunity to ask and get questions answered. Like I said, I'm really excited about our webinar today. Obesity is something that the Maine Public Health Association focuses on. It's our #2 leading cause of preventable disease and death in Maine and in the United States, quickly creeping up on tobacco. And two folks who have been working on obesity policy for over 10 years have agreed to join us today and provide us with some really important and timely information around childhood exposure to marketing in schools. And that's Michele Polescek and Karen O'Rourke from the University of New England. Like I said, both of these women have been working on obesity policy for over 10 years. Michele is an associate professor of public health at the University of New England, and Karen is the associate director of the School of Community and Population Health at the University of New England. So I really want to thank Michele and Karen for joining us today. I'm going to unmute them and I'm going to let them take over. And as just another reminder, you can put any questions you have in the chat box at any time throughout the webinar, and we will answer them at the end. Okay? So I'm going to go ahead and unmute Michele and Karen and let them take over.
Okay, thank you, Tina. Can you hear me okay?
Yes, I can. Great.
Great, great. Well, thank you, and thanks for this opportunity for us to be able to highlight our work. So this is Michele, and I'm going to do part 1 of childhood exposure to marketing in schools, how to change the scene. And our research was funded by the Robert Wood Johnson Foundation under 2 Healthy Eating Research Program grants, round 4 and round 8. So next slide, please. All right, so I'm going to start with just a bit of background about why we should care about food and beverage marketing at school, present some very brief findings from our 2010 school marketing study, and then that will lead right into what really is the focus of this presentation for my part, which is the current study, process and findings. Next slide. So nearly $2 billion a year are directed at youth in terms of food marketing expenditures. And 90% of that is for unhealthy food that's high in sugar, fat, and sodium. Next slide. And in terms of marketing at school, 48 national food and beverage companies spent $149 million on in-school youth-directed marketing in 2012, and there's no reason to believe that that number or that percent of total marketing would have gone down since 2012. If anything, it would have gone up. And that marketing comprises 93% of that is for carbonated beverages, juice, and other beverages. So that's the vast majority of the in-school directed youth marketing. That estimate is definitely an underestimate because it doesn't include local quick service franchises, which are selling products and advertising in schools. It does not include sponsored educational materials, and it definitely does not include digital marketing to kids while in school or on school-issued devices, which we know industry has been increasing their spending on recently. Next slide. So why should we care about school-based marketing? Well, for one, we know it works, and otherwise the industry would not be spending money in this area. It conflicts with values and the purpose of education. It reinforces marketing outside of school, which threatens health. And the reason it threatens health is because much of the school-based advertising is for unhealthy foods, just as the advertising outside of school is. It increases health disparities because there are marketing disparities. Minority populations and populations of color, for example, are marketed to more with more unhealthy products. It increases it decreases self-esteem by promoting consumer culture and personal insecurity. It threatens values through the market values versus civic values that are promoted through marketing. It affects body image, again, fostering insecurity through and it also threatens learning processes. It discourages critical thinking and promotes behavioral problems because of the manipulation inherent in marketing. And it also threatens personal development with its focus on material goods versus creative pursuits and healthy relationships. So I bring all this up because these are evidence-based threats that are talked about in a yearly report on school commercialism that comes out from the National Education Policy Center. And all of this for very little revenue. Schools get 0.002 to 0.03% of their school budget from school-based marketing. Next slide. So our first study, I just briefly cover what we found. No statewide survey of marketing in schools had taken place really before 2010. So we set out to explore the nature and extent of school-based marketing in 20 randomly selected high schools in Maine. And we also set out to assess compliance with a statewide school marketing ban, which was in place at the time, the Foods of Minimal Nutritional Value ban. Next slide. And this is just a picture of product marketing, obviously marketing on the product themselves. I'm just showing you a couple pictures of the types of marketing that we looked at in schools. Next slide. This is direct marketing, which is marketing on posters and signs, either on walls or on vending, for example. Next slide. And this is indirect marketing, which is marketing in conjunction with other products or services. In this case, Poland Spring on a cup. Next slide. And I'll just jump right to what we found, which is you can see here the 10 most frequently marketed products on posters and signs and vending. And in red, I have the products that were not compliant with the Foods of Minimal Nutritional Value standard. And so you can see that Coke and Pepsi comprise the most frequently not compliant products that were marketed and also comprise 45% of all the marketing found, all the not compliant marketing found. Next slide. And most of that not compliant marketing was found in athletic areas, teachers' lounges, and cafeterias, with an average of 12.1 instances of not compliant marketing per school. Next slide. Also, we found a lot of not compliant marketing on scoreboards, and here you can see that, again, Coke and Pepsi came up with were the top most not compliant marketed on scoreboards. Next slide. Schools told us that they really wanted more resources to help implement the law. 70% wanted more information about the law, including what is banned, and more than half wanted technical assistance on how to implement the law better. Next slide. So all this information really led us to apply for another study, which would allow us to assess marketing compliance with a new federal standard that was put in place for the sales of competitive foods under the Healthy Hunger Free Kids Act. And we also wanted to see what kinds of resources it would take to get marketing that was not compliant from with a new law out of schools. So we wanted to provide technical assistance to schools, engage in a marketing improvement process, assessing the resources required, and then we also set out to explore forms of digital marketing exposure, but I won't be covering that aspect of the grant today. Next slide. So now I'm going to show you what we found in terms of the baseline in the new study. And remember, this is just 3 schools, thank you, 3 schools in Portland. And overall, so you'll see here, spring 2014 and fall 2014, our funder wanted us to do 2 baseline assessments in case schools were gearing up for the new smart snack standards and were making changes in their marketing based on that, just in case. Well, we didn't find much here. So you can see that all marketing in blue and not compliant marketing with the smart snacks, which is this new federal standard for sales in schools, which I guess I should explain that this is a new federal standard for sales, but the marketing standard would most likely be based on the sales standard. The marketing standard still has not been finalized. Next slide. So breaking those numbers down a little bit, I'll show you the marketing in the high school, middle school, and elementary school that we worked with. In light blue, you see the instances of marketing on posters and signs. The dark blue is the instances of marketing on vending, and then the different shades of the red are instances of not compliant marketing. And you'll see that in the spring and in the fall of 2014, there really wasn't a huge difference in terms of the not compliant marketing that we found in terms of baseline. Next slide. All right, in the middle school, very kind of similar numbers in terms of the not compliant marketing in both baseline periods. Next slide. And very little not compliant marketing was found in the elementary school. Just 1 instance in the spring and 2 instances in the fall. Next slide. So the 10 most frequent products marketed in school in 2014 in terms of the not compliant products were Snapple, Arnold Palmer, and Coke. And of course, those are sugary beverages. And you can see that those are 28, 6, and 6 in terms of the instances. Next slide. Okay, we also looked at city-owned venues because at the Portland High School, city-owned venues are used for most of the sports, both practices and games. So the Hadlock Field is used for baseball, the Portland Expo is used for basketball, the Ice Arena is used for ice hockey, and at Fitzpatrick Stadium, soccer, lacrosse, football, and track practices and games are held. Next slide. So overall, in terms of instances of marketing in school versus city-owned athletic facilities, you can see here that school-owned athletic facilities have much less marketing overall, but also the percentage of not compliant marketing compared to compliant marketing is much lower than in the city-owned athletic areas. Next slide, and I'm going to break these out for you. So this is the outside of Hadlock Field, and this Coca-Cola sign welcomes you in. And then the next slide, please. You can see, and I know this is not a very good quality photograph, but you sort of get the picture that there's nothing but really marketing everywhere you look. Next slide. And we often see, well, and this is a picture from Hadlock Field. This is marketing for alcoholic beverages as well. Next slide. So at Hadlock Field, 56 instances of marketing were found, 43 of them not compliant, a total of 77% of the marketing not compliant with the Smart Snacks standards. Next slide. This is the outside of the expo. Next slide. And typical of what you see on the walls inside the expo. Next slide. And 48 instances of marketing, 80%, or 38 instances not compliant with the standards. Next slide. And the ice arena, similar. Next slide. 26 instances of marketing, 11 not, or 42% not compliant with the standard. Next slide. Oh, and Fitzpatrick Stadium, which is pretty much exclusively used by youth, I believe. Next slide. 2 instances of marketing, and both of those not compliant with the standard. Next slide. So in terms of the 10 most frequent products marketed in city-owned venues, you can see that Coke and Pepsi also top the list here, and then we have a whole host of alcoholic beverages which follow. Next slide. So once we had our baseline assessment, we began our school improvement process, and we paid for half of a school health coordinator's time to be able to work with the school health coordinator, and my co-conspirator Elizabeth Pratt is here to help answer some questions later, and I'll have her talk about a couple pieces in a bit. So she met with each principal and worked with or restarted wellness teams that either existed or had kind of stopped meeting regularly at some of the schools to create an improvement plan for each school. And we tracked and documented each change and the cost required and the resources required to do that. Next slide. And this is an example. I know that there's a lot on this slide, and I just wanted to give you examples of kind of what we did. So I'll let her talk about this, but for example, here we have some storage boxes in each of the in the school that we worked with, and we tracked the instance of marketing, the location, removal options. We took pictures whenever we could, talked about the resources, and then talked a little bit about the process. So I'll let her explain a little bit about what happened.
Sure, I can. Cool. Sure, this is Elizabeth, and I can just give a quick highlight from each of the schools that we worked with. This was an elementary school, and I think the first step in working with this school was to find a liaison or a champion from the school to help do some of this assessment work and then do the improvement plan. And in this case, I worked a lot with the assistant principal and the librarian, and they were really wonderful to work with and helped me in terms of looking through the school and finding the non-compliant marketing. And it was sort of a surprise in this case where we found that there was a lot of unintentional marketing from the food pantry boxes because a lot of teachers didn't have places to store extra materials in their classrooms, and so there were all these boxes available for free once the food was consumed, and so we did find quite a few boxes that had the marketing on them. So our solution was to purchase clear bins for them, and a lot of them were able to replace those boxes with the bins.
Perfect. Next slide.
So in this case, it was a middle school, and again, the first step was to find champions to work with, and we worked with a really strong wellness team that met regularly, and then also worked with the athletic director, who was very helpful. He was a PE teacher and athletic director at the middle school and the school custodian. And they were all very helpful in terms of addressing really two types of marketing. One of them was on the vending machines. And we worked with Jason Seavey from National Beverage, and he really, with no hesitation, had the panels redesigned and changed so they were compliant. So that went very, very well. It was very smooth. And then the other thing that we did was there was a Coca-Cola sign in the gym, and we worked first with Jason Seavey to talk about replacing the Coca-Cola with water advertising, but then because the principal and athletic director didn't really want to do any marketing, we came up with a creative strategy to put the school mascot on the panels instead. So that was a great result. You can do the next slide. And then this one is the high school, and we had actually a pretty easy process here in working with the principal. She was really great to work with, and we identified some signage in the cafeteria with non-compliant marketing on some homemade recycling signs, which were creative, great signs, but they didn't have the appropriate examples of products to be recycled. So the principal worked with us to switch those out so that they were compliant.
Thank you.
Yeah.
So this slide shows the marketing changes, instances at baseline to post, and this is instances of not compliant marketing. So just to show you, in the elementary school that we worked with, there were very few to begin with, and there were just a couple also at post. And then both in the middle school and the high school, we drastically reduced the number of instances of non-compliant marketing, but we weren't able to completely remove those, and that was likely because both of these schools had pantry storage boxes, at least likely pantry storage boxes that made their way into the classrooms with marketing on the outside of those boxes. Next slide. So in terms of the resources that were needed to get this marketing out of schools, the school health coordinator was by far the biggest cost. Having someone there to actually check on the work, liaison with the wellness team, the principal, or whoever the contact was in the school, was really the most important piece and the biggest cost. The distributor, National Beverage, replaced non-compliant vending panels for free. And the rep was really easy to work with. Coca-Cola signs in the gym in the middle school were replaced, as Elizabeth said, by sticky decals of their school mascot, the falcon, for around $100. And this worked really well because they liked the idea of having that sort of school pride decal of the falcon in the gym versus the marketing. And the Portland High School recycling signs were replaced by the recycling club at no cost. Next slide. So the key challenges or lessons learned. It was definitely a challenge for Elizabeth to contact school personnel at first, but once she was able to create those relationships, it got easier. The athletic directors pretty much owned the gyms, and that relationship was really key. It was really important in the middle school to be able to change that falcon out for the Coca-Cola. Kind of figuring out what will motivate change in schools. Again, the school pride piece in the middle school was really easy. Just knowing what school administrators are interested in and what will motivate them to make changes is an important piece of this. Food pantry boxes that made their way into the classrooms were a challenge, and another lesson is that much of the marketing we found was not school commercialism per se. Schools weren't really paid to have the marketing. They just kind of marketing that made its way into the classroom, and so this is going to take vigilance on someone's part to track all of this. And then the city-owned venues is a major gap. Next slide. So in terms of implications for policy, I think we need a mechanism and assessment, somebody's role and paid time to track, monitor, and make sure that marketing that's not allowed stays out of schools. Wellness policies can help to address the food pantry issue, this non-commercial marketing that we found in schools, and we also need to find ways to address the marketing in city-owned venues. And that's the end of my part one of my presentation, and I'm going to let Karen take over.
Great, thanks, Michelle, and thanks, Tina, for having us and everyone who's participated. So this really, these flow really nicely, these two presentations, because what I'm going to be talking about really happened really at the same time as Michelle and Elizabeth were working on theirs. And this is a project, though, the Cumberland District Public Health Council to eliminate soda scoreboards in public schools. So just what I hope that by the end, oops, can you go back one more? I hope that at the end of this that you'll, back one more, yeah, thank you. At the end of this, what I want to do is explain the process that we went through to eliminate the junk food on the scoreboards, and then really talk about the partnerships and roles, because I think this is something that everybody on the call could probably take and move forward. So next slide, please. So Michelle talked a lot about the role marketing plays in childhood obesity. So I'm not going to talk a lot about that, but I just want to say that I really like this particular quote because I think it really nicely summarizes the issue and why it's important. And that is that unhealthy marketing is pervasive and often targets young children, leading them to nag their caregivers until they buy unhealthy foods. Over time, these kids can develop a preference for foods that are bad for them, a preference that can last a lifetime. So that's why that's an important thing to do. Oops. Next slide.
Karen, I just wanted to apologize. I'm not doing that. Some evil forces have taken over for a moment. But
no, this happened to this happened when I do it too. So yeah, I know, evil forces. So go to the next slide then, please, Tina. So getting scoreboards in public schools that are free of sugar-sweetened beverages advertising is actually, in Cumberland, is actually a process that started about 10 years ago. In 2007, after the recommendations from the Commission to Study Public Health that focused on obesity policy, a bill was passed that prohibited soda advertising on scoreboards, and Michelle discussed that a little bit. So that state law did result in the removal of some of the sugar-sweetened beverage scoreboards in Cumberland County. But then you heard from Michelle that research they did in 2010-11, we found that some of that was that the implementation was weak, and it really took what we did with our partners in 2014-15, just this year, really took us to the next step that we really needed to get to the final result. And so here we are. So this is what things look like in Cumberland County right now. They look pretty good, but you can see in 2014 where we started, if you go to the next slide, please. Yeah, so this is what we started with. And as you can see, and these aren't all the scoreboards that we found, but it looks really, really different. Okay, so the next slide. So the project was completed under the umbrella of our Cumberland Public Health Council. Our Cumberland District Public Health Council. And because some people on the webinar may not be familiar with this structure, I just want to briefly explain that because Maine doesn't have these county health departments, what we do have is 9 district coordinating councils made up of volunteer stakeholders. So in our Cumberland District Public Health Council has a mission to promote health by providing information, coordination, and advocacy. So that is the umbrella for this project. So the next slide, please. So in 2013, the Cumberland District Public Health Council identified obesity as one of its priority areas. So we established a work group with this charge, which was to identify opportunities that exist within the district, which is Cumberland County, to impact obesity and then take action on one or more of those opportunities. Okay, so the next slide. So here we put together our work group. So included Bethany Sanborn from the Public Health Division, Portland Public Health Division, who was the co-chair along with me. We had Kathy Savoy from the University of Maine Cooperative Extension, Ashley Edmondson from the Let's Go person from Opportunity Alliance. Go back again. Ann Lang from Healthy Casco Bay, Kristen Dow from Healthy Portland, and then myself. So this is the core group that worked on this project. So the next slide. Okay, so the work group met to determine what we would do and when we would do it. So because there were already a lot of groups that were working on different aspects of obesity prevention, we started with a scan of what was currently being done, and then we identified the gaps. We reviewed CDC's list of best practices for obesity prevention, and then we looked at available research, including the study in Maine that Michele Polescek had done to see the results of that. And what we needed to do was select a project that could be completed in 1 or 2 years. And this is the important part, that would not require funding. There was no funds to do this work. So everything that you see that we did without any funding, just the time of the work group members. So, I think that Michele Polescek talked about that project and had a grant, which is great because now we're going to use that information again, but our project had no funding to do it, which is why everybody on the phone could probably do some of it. Okay, so the next slide. So Michelle's study, as she talked about, that we looked at this, and there's a lot of findings from this study, but this one really jumped out at us, that 63% of schools had scoreboards that were not compliant with Maine's school marketing law. So, and then next slide. So that seemed like a doable challenge to this group, so we set out the goal, which was to make all Cumberland County schools scoreboards free of soda ads. So that was our goal. So the next slide, please. So as we embarked on this project, we had 2 tools that helped us do that. First was there a state law. So this is a law that was passed in 2007. It was called an Act to Protect Children's Health on School Grounds. It was LD 184, now called Chapter 156. And it had 2 parts to it. One related to tobacco use on school grounds, and this was the other part, which basically said brand-specific advertising of food or beverages is prohibited in school buildings or on school grounds, except for food and beverages meeting standards for sale or distribution on school grounds. So I'm not going to explain all of that, but basically what it says is that if you couldn't sell it, you couldn't advertise it. And even back in 2007, soda was not allowed to be sold except with a couple of exceptions, like in teachers' rooms. So if you can go back one more. So this is this, I just wanted to show this reference. This is the study that was done, Michele Polescek's study in 2010, and this is a reference, and she already talked about the aim and the funding, so this is where it is. If you go to the next slide. And she also showed you this particular thing, which was also good for our group to have, because we saw what it was that we were expecting to see on scoreboards. So you could saw that Coke and Pepsi and Mountain Dew were the 1, 2, and 3 most often products sold that did not were not compliant with the state law. You can stay right there, Tina. And this was the other finding that was really important to the project, because it told us that we needed to present ourselves to schools in a way that showed that we were providing assistance and resources, and we were not there to be punitive, because one of the findings, the other finding of the research was that school administrators feel that banning food and beverage marketing in schools is important, but they needed more information, technical assistance, and resources to help make it happen. And these slides keep jumping all over. My apologies, everybody. This is fine to stay where you are, too. Yeah. So we compiled, this is a process that we went through. So we compiled a list of all the schools. So we were looking at 12 school districts. So we didn't include Portland because of the project that was going on there. So the other 12 districts in the county. And that included 67 schools. We also did not go to the island elementary schools because, if you remember, we didn't have any money to go out there. So we also knew that there would be a cost to replace the scoreboards, so we need an additional partner. And so for many years, the Beverage Association said they'd be willing to replace scoreboards that had soda on them. So we contacted the Maine Beverage Association and asked them if they'd be willing to partner with us on this project and to replace any signs that we found that did not comply with the state law, and they agreed. So then the work group, can you go back one more? Thanks. The work, back 2 more now. Yeah, thank you. So the work group, what we did is that we went out and visited each of the schools to check the scoreboard. So it's really important that you actually go out and see the schools. because the schools, if you call them, they really won't know whether or not some of their scoreboards have soda on them. We looked at all the fields and all the gyms. So in high schools, that could be anywhere from 4 to 6 fields, plus the gym, maybe a pool. Middle schools have 3 or 4 fields, plus the gym. And then elementary schools, it was pretty much just the gym that we looked at. Okay, so the next slide. So what did we find? So we found that 8 of our 12 school districts, or 67%, had at least one sugary drink branded scoreboard. And it wasn't any one particular field. It was all over the place. It was the football field, track field, baseball and softball fields, multi-purpose field, soccer field, the gym. So, and the ads were Mountain Dew, Coke, and Pepsi, as we saw from the research. Okay, next slide, please. So the person to contact in a school about anything related to athletic venues is the athletic director. It's not the principal, it's not the superintendent. So we sent a letter to each athletic director and explained what the Cumberland District Public Health Council was and what we were trying to accomplish. We referenced the law and we provided them a copy of the law along with a copy of a fact sheet that was done for us by Change Lab Solutions called Understanding the Law, which just kind of breaks that down a little bit. We explained the role of the Maine Beverage Association in switching out the soda ad for a water ad and let them know there'd be no charge for that. And then we sent a copy to the superintendent. So next slide, please. So this slide just shows you what we gave to the Beverage Association. So everything in yellow is what we provided to the Beverage Association. So it included the school district name, the athletic director. We just have initials here, but we gave them the actual athletic director's names, the athletic director's phone number, what the current logo was, because they needed to know whether to replace it with a Dasani or an Aquafina, and then the actual location of that particular field, and then so that they could figure out what it was that could be fit right over the Sugar Sweet Beverage logo. So next slide. So then the Beverage Association, he actually went and either contacted or visited each of the schools to find out the size of the sign. And then he ordered the signs and had them delivered directly to each of the schools. And then it was up to the schools then to have their facilities personnel replace it. So as you can see in this photograph right here, the Freeport sign is that was a Pepsi logo right under that Dasani, and they just went in and screwed that sign right onto over the Pepsi sign. And some of them were different kinds of things, but they're really easy to, it was really relatively easy to replace. Okay, next slide please. So then the committee rechecked several months later, and of course we found out there are several of the schools that still had not switched out their scoreboard. So we recontacted all the athletic directors, I think there was 2 or 3, and reminded them to send them out. Some of them just forgot, and some of them said, oh yeah, I just did it yesterday. So, and so most of the schools now have made the transition. We did find out that there is one problem. One of the signs is the wrong size, so that has to be reordered. But 4 signs were taken down and not replaced with any advertisement, which is actually ideal, I think. 7 scoreboards have now have water products on it. Okay, next slide. So once again, the partners, this is a group that did it, and we have to add the local school districts and New Augur from the Maine Beverage Association, because this is the partnership that really helped make this happen. If you go to the next slide. So some thoughts on partnership. So you really need partners if you're going to do it county-wide, and I think any SCC or any county group could do this. We had 67 schools with athletic fields all over the place, so it really helps if you have partners who actually know where the schools are and know where the athletic fields are, because some of those athletic fields are quite hidden. Secondly, our relationship with the Maine Beverage Association, we made very clear from the beginning that we're going to partner on this particular project, but acknowledge that we could be on different sides in the future. And in fact, we did have a pretty contentious legislative session where we were on the opposite sides, but we kind of put that aside for this particular project. Next slide, please. So the Beverage Association was critical to cover the cost of the replacement, and we do really appreciate that they did that for us. I think the umbrella of the Public Health Council was really helpful. I think it added some credibility to the project. It wasn't one organization going after them. It was sort of this group of organizations asking them to do something to improve the health of their community. And so I think that was great. And also schools are great partners, but it really needs to be easy for them to participate. And I think we did really make it as easy as possible. So summary of lessons learned, having a state law is critical to the success, but you just can't assume that the law is being implemented. And knowing that there was a lack of statewide compliance with the law, that being able to have that research really was an important piece of evidence in determining local programming. And in fact, the work that they've done right now is, you'll see we'll be using it again in the future. Go to the next slide. So without any funding, which we didn't have, so it takes partners who are willing to just go to every school to examine the scoreboards, to revisit and recontact schools when needed, and to fund the sign replacement if sign removal is not an option. And so, and also, although it's not a priority for schools, they are willing to participate, as I said, if it's made easy for them. So once again, this is where we started, which doesn't look very good. And if you go to the next slide, that's where we are right now. And given that there's thousands of students, their family members, and community members that see these scoreboards every year, I do think this adds greatly to creating a healthier community for those of us in Cumberland County. So our next project is that we're going to go look at those city-owned venues that aren't covered by the school law and see what we can do to get those replaced. We will be looking at some of those city venues that Michelle just talked about in the city of Portland. We have some of those and also we're going to look at some of the private schools too that aren't covered by the law and see if we can get some support from them. So that's our next project, and I think that the group, we met yesterday, we have a strategy, and hopefully in a year we'll see some of these other venues where mostly kids use, see some of those changed. And once again, just like to acknowledge Bethany Sanborn as the co-chair, the rest of the members of our Cumberland District OBC work group, and many of those slides were Michele Polescek's slides, so we're going to thank her for that. And please contact me if anybody wants any information. We're happy to share our letter to the athletic directors, information on contacting Newell Auger, anything that you would want, we'd be happy to share that information with you. So I think that's it for me. Thank you.
Thanks so much, Karen and Michelle. That was great. I want to apologize for the slides advancing on their own. I think we somehow got them set on auto advance, and there was nothing I could do in the middle of that. So I apologize for that. But hopefully everyone was able to keep up. And we have one chat question already from someone. So I'm going to go ahead and read that so we can maybe have some discussion here. Oops, I just pulled out the wrong one. Huh. Where is my, there we go. The question is, oh, there we go. Did replacing the Coca-Cola signs with the Falcon cost anything to the district? Sometimes these signs are sponsored by the companies with an agreement, in an agreement with the district that spans a few years.
Well, I'll start us, and if Elizabeth has, this is Michelle, if Elizabeth has something to add, she can. No, in terms of the contract, there was nothing, all the contracts had run out in terms of needing to display the Coca-Cola signs. That, I mean, given that there's a state law that prohibits that kind of signage for non-compliant products, I believe that would supersede any kind of contract that even might be in place with the school. So it just cost us the $100 for to buy the decals. We went to Staples or somewhere, Fast Signs, and just got magnetic.
Actually, no, we started with the idea, the custodian had the idea of doing magnets because to make metal panels to screw into the metal, it would have been too costly. And then the magnets, the custodian tested the metal and magnets didn't stick to it. And then we were worried that a ball might hit the magnet and it would fall. So he came up with the idea of the stickers, and that ended up being the cheapest solution as well.
So that came out of grant funds. So we had money from Robert Wood Johnson to cover marketing removal, and we were tracking that. So that was about $100. Hope that answers your question.
This is Karen. I just think there's a ton of schools out there who have because nobody said to us, oh, we have a contract, you know, that's an issue. So I don't think there's a lot of schools that do that anymore. I think they used to, but I don't think they do that a lot anymore. Anything else, Tina?
Yes, I'm seeing another question. Hold on, please. We had a question, were students involved in any of the research or outreach efforts?
So this is Michelle again. Yes, we offered to include students in our assessment procedures and our school improvement processes. And some schools took us up on that, and others didn't so much. But at the middle school, I had in both baseline assessments in both the spring and the fall of 2014, we had the same 3 students walk around with us and do that, and they were middle school students, and they really enjoyed that, and it was really helpful to have them to help us, you know, understand like all the nooks and crannies of the school, and they were also supposed to then participate in the improvement process, but that didn't quite go as expected. I don't believe there was a student representative on the wellness team.
Sometimes students came to the wellness team meetings, and we had some plans to work with art students to redesign the signage in the high school, but that proved challenging in terms of the staff time. That was the biggest barrier, and I think the principal was really protective of her staff, you know, and their time and the students' time, so we weren't able to do that.
I would just like to add that I think getting students involved in this is the perfect solution. And actually, at the high school, I offered to do an internship with high school students who needed, because they have like a senior internship that they can do. And the person who directed that was very interested. I made a 1-page flyer, put it up on the walls, they advertised it, and we got no takers. So anyway, but I do think it's a wonderful way to involve students in the policy change process.
I have and one more question, and that is about evaluation. You did a lot of great pre and post assessment, data gathering. Was there any evaluation done on the effectiveness of the project or the health impact?
So in terms of effectiveness, we looked at the environment. So we really just looked at the marketing pre and post our intervention. In terms of effectiveness, like effectiveness on health, the scope of our study would not have been able to prove that, and we didn't really have the resources to look at this over time. It would take a lot of time to do that, and we know that marketing, you know, others have done studies on marketing's effectiveness in terms of getting people to buy the things that are being marketed. We know that that's true, and we also can make the connection between what people are buying and eating and health. So we didn't need to do that in this study. We know that removing marketing is going to positively contribute to a person's health because those connections have been made in larger studies that are experimental and people have spent a lot more money on than us. So then what we had available to us and what we were able to do, we only worked in these 3 schools in the second study and in terms of the marketing removal.
That's wonderful. Were there any other questions from folks? You can put your hand up and I can unmute you, or you can write a question in the question box. You do know how to get a hold of Karen and Michelle. Well, at least Karen. Karen's email's up there. She sits near Michelle, so you guys can ask questions of them anytime. You can also feel free to ask me questions, and I can pass those on. If no one else has any other questions, I'm going to move on to the fact that we have another great webinar coming up this Monday, the 14th at 10 a.m. regarding telehealth and public health, and how this has a huge opportunity to improve access for rural populations in Maine. thank you all so much again for joining us, and of course, mostly to Michele and Karen for not only doing this great project, but providing the information and analyzing it and providing it to us in this manner. And also just another shout out to both of these women because they remain involved in obesity policy efforts, not just limited to marketing in schools, but other policy efforts as well. And they have been instrumental to MPHA's efforts at the State House and beyond. So I think they know how much I appreciate their efforts, but I just wanted to say it publicly, what a great resource they are to all of us around the state. So thank you guys again, and thank you all for joining. I hope everybody has a great day.
Thanks, Tina.
Thank you.